Good morning, and welcome to the statewide Asthma Disparities Conference entitled Clearing the Air, Addressing Asthma Disparities in Maryland. A special thanks to our musicians, neither of whom have asthma, but who do have the gift of breath in order to play so well. Their presence here today invites us to focus our attention on Maryland's senior population, a group that is often impacted by asthma disparities. We extend sincere thanks to the conference sponsors. Thanks go to the Baltimore City Health Department and to DHMH, the Department of Health and Mental Hygiene's Office of Maternal and Child Health, and to its Maryland Asthma Control Program. We wish to recognize the Planning Committee members, whose names are on the back page of your program. We also wish to thank the two agencies that co-chaired this conference for their resources and help. These are the Maryland Greater DC Chapter of the Asthma and Allergy Foundation of America and the Baltimore Area Healthcare Education Center, known as the Baltimore AAF. My name is Elisa Menstelia. I am a parent of two children with asthma. I serve on the board of the local Asthma and Allergy Foundation chapter. I am here to help represent the human side of asthma. Today, while we will indeed be treated to exceptional panels and scholarly discussions about emerging trends and successful model programs, part of our agenda also includes stories and videos from patients and families impacted by this chronic disease. The Planning Committee chose to include these stories because to effectively address asthma disparities, healthcare providers must always hold the human side of asthma in their hearts and in their minds. As a result of this conference, you will have a better understanding of the factors that contribute to asthma disparities in Maryland. In sessions and on your lanyard flash drives, everybody has them. In sessions on your lanyard flash drives, we will, you will find tools and model program strategies to overcome disparities in your community. Your mission today, should you so choose to accept it, is to take back what you learned and implement change in your community. There's a call to action form in your conference folder. It's on NCR paper, so you can turn in the original copy and keep one for yourself. Throughout the day, jot down ideas about how to take what you learned here today back to your workplace. What changes can you implement? What tools on your lanyard flash drives would be useful to your patients? How can your school, clinic, or program incorporate strategies that impact asthma disparities? If you turn in your call to action and bright green conference evaluation forms, both are in your folders, as well as attend the afternoon general sessions, you will be eligible to win one of our door prizes: an Austin air filter valued at $500, a $300 cash prize, an Amazon Kindle, and other fun prizes. We need your pledge form to take action as a result of this conference. We need to impact asthma disparities in Maryland. I would like to turn the podium over to Valerie Nozia of the Mid-Atlantic Asthma Foundation, who will introduce our first speaker. Thank you.
And welcome everyone once again to today's conference. My name is Valerie Nozia, and I'm with the Maryland Asthma Control Program along with the Maryland Asthma Executive Committee. I am pleased to introduce our speaker of the hour, Dr. Joshua Sharfstein. Dr. Sharfstein was appointed by Governor Martin O'Malley as Secretary of the Maryland Department of Health and Mental Hygiene in January of 2011. His prior tenure was with President Obama, who, March 2009, appointed Dr. Sharfstein to serve as the Principal Deputy Commissioner of the U.S. Food and Drug Administration, the agency's second highest ranking position. But many of us remember Dr. Sharfstein when he served as the Commissioner of Health for Baltimore City, where he led efforts to expand literacy and pediatric primary care, to facilitate the transition to Medicare Part D for disabled adults, and to engage college students in public health activities. Dr. Sharfstein is a graduate of Harvard Medical School, and we are lucky to have him with us today. Please join me in welcoming Dr. Joshua Sharfstein.
Good morning.
I will never forget the night that our son Brandon went into respiratory distress without warning. 6 years have passed since that unforgettable evening. Brandon is now 8 years old. He is a force to be reckoned with on the football, rugby, and baseball field. Brandon does not suffer from asthma. He lives with asthma. Jackson, our second son, was born in 2008. We prayed that he would somehow escape a similar diagnosis. Unfortunately, on Christmas Eve, in a snowstorm, we were escorted by a snowplow that cleared the path so that the ambulance could get him to the nearest hospital. Jackson is now 2.5 years old. He's had medical complications since the day he was conceived. Asthma is just one more obstacle that he has been able to take on without fear. My name is Elisa Mintz-Delia. My husband Michael and I work at Kennedy Krieger Institute. I stand before you to tell you that asthma can humble any family. Asthma does not discriminate. It does not matter your occupation, race, sex, age, education, physical or mental condition, or economic status. I ask that over the course of the day, as you make your plans, goals, and commitment to implement change and address disparities in the state of Maryland, that you consider the following battles that our family has faced with our sons. Emergency room visits are a challenge. When you've been to the emergency room as many times as our family, they not only recognize you, but the staff know you by name. Well-controlled asthma is essential, but even with the best plans in place, emergency room visits may still be necessary. Home monitoring equipment is expensive and not covered by insurance. Without these tools, parents are left with fear and worry about whether their child will survive through the night. The psychosocial effects are a challenge. Parents worry every night at bedtime that their child will have an episode that night. While most children can go to sleepovers and play dates without a second thought, we as parents live in fear of whether the supervising parents will recognize the signs and symptoms of an asthma attack. Few want that extra responsibility. Similarly, babysitters are often hard to find and to keep, as many fear that if there is an emergency, they may not know how to react. Even close family and friends hesitate to stay with our children for long periods of time. Childcare is always a challenge. Finding childcare for children under 5 is difficult enough. Finding inclusive childcare for young children with asthma is even more difficult. At Brandon's first daycare, medicine was not dispensed properly, which resulted in an admission into the hospital. This same daycare requested that we look for an alternative placement because they did not feel capable of providing the necessary medical support and supervision for a child with asthma. Of course, we changed our facility. Transition to school can be a challenge. Each time a child with asthma changes schools, parents need to set up support systems to protect the child. You saw the walking sandwich boards here today urging the use of asthma action plans that are established with a treating physician, reviewed with the school nurse, and filed in the health suite. One day Brandon's school nurse was out and his medication was not dispensed in a timely manner. The result was another emergency room visit. Issues like this make parents question if the school personnel are appropriately trained to be aware of the needs of children with asthma. For example, when my son asked his substitute teacher to go to the nurse to get his inhaler, he was told, "You don't need that. You will live. Just go get a drink." It is a situation like this that causes parents to question the safety of their child while at school. In closing, I have no idea what the future holds for my sons. I can only hope their asthma will be well monitored and controlled so that they can grow into independent adults. Yes, asthma can humble any family. With respect to the human side of asthma, families are the same. Yet there are distinct differences between my family's situation and families that are impacted by the factors and barriers that contribute to asthma disparities. My husband and I are educated. We have resources to address the health needs of our children. We have health insurance and family support systems. We spend time researching the best solutions and learning about the disease. So I leave you with this thought. If with these resources, our family found asthma management challenging, please consider for a moment how difficult it is for parents with no resources, little education, and few support systems to cope with the impact of this sometimes overwhelming disease. I thank you for the privilege of allowing me to take part in this very important day. I would like to take this opportunity to turn the podium over to Dr. Clifford Mitchell and invite the next panel to the stage to discuss the barriers and factors that contribute to asthma disparities. Thank you.